We'll talk about fever in children today. Fever, that condition that often makes children miserable and parents very sleep deprived. Nearly every child will develop a fever at some point. The challenge for parents and caregivers is to know when to become worried, when to be concerned. Let's talk about some basic concepts associated with fever in children. Fever is a normal body response, often in the presence of an infection, when the body's temperature is elevated due to a resetting of the body's thermostat to a higher than usual temperature. A fever means a temperature above 100.4 Fahrenheit degrees. You might get slightly different numbers depending on how you take your child's temperature. Infection is the most common cause of fever in children. There is insufficient evidence to support the belief that teething causes fever. In fact, temperatures above 102 degrees should never be attributed to teething. Remember that bundling a child who's less than 3 months old in too many clothes or blankets can increase the child's temperature. However, a rectal temperature of 101 degrees or greater is not likely to be related to bundling and should be evaluated. Remember that also that there are some childhood immunizations that can cause fever. Let's talk about measuring your child's temperature. Digital thermometers are inexpensive, widely available, and the most accurate way to measure your child's temperature. On the other hand, glass thermometers that contain mercury are not recommended due to the risk of exposure to mercury, which obviously is toxic if the thermometer is broken. That is why they're not in use any longer. Plastic strips and pacifier thermometers are not as accurate as digital thermometers and are really not recommended. But how do you measure your child's temperature? The answer is, well, it depends. For children who can hold a thermometer under the tongue, usually children older than 4 or 5 years old, the temperature can be measured accurately in the mouth. However, for infants and children who cannot do that, the temperature can be measured in the armpit. If the armpit temperature is over 99 degrees and there is concern that the child is ill, then a rectal temperature might be better and necessary. Temperatures measured in the ear or in the forehead are less accurate and may need to be confirmed by one taken orally or rectally. It is definitely not accurate to estimate a child's temperature by feeling the child's skin. That is, you can determine the degree by that. A big question is, should I treat my child's fever? Fever may play a role in fighting infection, but it can also make a child very uncomfortable. How high the temperature is not always the best indicator of whether the child needs to be treated or evaluated. Instead, it is important to note how a child behaves and appears. So, when is it recommended to have an evaluation? An evaluation is recommended by a healthcare professional in the following specific situation, and they're very important. Infants less than 3 months of age who have a rectal temperature of 100.4 degrees or greater, they should never receive acetaminophen or any medication to reduce the fever until they have seen a professional. It is extremely important to have that evaluation. Children 3 to 36 months of age who have a rectal temperature of 100.4 degrees or greater for more than 3 days or who appear ill, they need to be seen as well. We're talking about a child who's fussy, clinging, refusing to drink fluids. Children who are 3 months to 36 months old who have a rectal temperature of 102 degrees or greater need to be evaluated. Also, children of any age whose oral, rectal, or ear temperature or forehead temperature is higher than 104 degrees need to be evaluated. Children of any age who have had a febrile seizure or who have a febrile seizure, these are seizures that happen when a child between the ages of 6 months and 6 years has a temperature of 100.4 degrees and that seizure occurs. Children of any age who have recurrent fevers for more than 7 days absolutely need to be evaluated, even if the fever lasts for just a few hours. Also, children who have a fever and have a chronic medical problem like heart disease, cancer, lupus, or sickle cell anemia, a fever needs to be treated, managed, and evaluated promptly. Finally, children who have a fever as well as a new skin rash, those need to be evaluated. So let's talk about treatment. Treatment of fever is recommended if a child has an underlying medical problem, including diseases of the heart, lung, brain, or nervous system. In children who have had a febrile seizure in the past, treatment of fever really has not been shown to prevent seizures, but is still a reasonable precaution. The treatment of fever may be helpful, particularly if your child is uncomfortable. Remember, they feel down, achy. But in general, the treatment of fever is not necessary. In most cases of fever, it is not necessary to treat a child's fever. A child older than 3 months old who has a rectal temperature less than 102 degrees and who's otherwise healthy and acting normally, that's usually not required treatment of fever. Let's talk about the treatment options, because this is something that concerns parents all the time. The most effective way to treat fever is to use a medication such as acetaminophen, which its sample brand is Tylenol, or ibuprofen, which sample brands are Advil and Motrin. Aspirin is not recommended for children under the age of 18 due to concerns of a condition called Reye syndrome, and that's a serious illness. Acetaminophen may be given every 4 to 6 hours as needed, but should not be given more than 5 times in a 24-hour period. And remember that ibuprofen may be given every 6 hours, but it should not be used in children younger than 6 months of age because we want to protect their kidneys. The dose of these medications should be calculated based on the weight of the child and not based on the age of the child. And don't forget that fever-reducing medication should only be given as needed and discontinued once bothersome symptoms have resolved. You can also manage the fever by increasing the fluids. Having fever can increase a child's risk of becoming dehydrated. Also remember that children with fever may not feel hungry, so it is not necessary to force them to eat. However, fluids such as milk, formula, and water should be offered frequently. If the child is unwilling or unable to drink fluids, just make sure that that child gets evaluated. Having a fever causes most children to feel tired and achy. During this time, parents and caregivers should encourage their child to rest as much as the child wants. It is not necessary to force the child to sleep or rest if they begin to feel better. Children may return to school or other activities when the temperature has been normal for 24 hours. That is particularly important because we want to make sure that they don't continue to be contagious. It appears that sponging is not as effective as medications for fever and generally is not recommended. Please remember that alcohol should not be used for sponging because of the risk of toxicity if it is absorbed through the skin. So here are my 5 points to remember about fever in children. First, it is a natural response. Second, it is defined as a temperature of 100.4 degrees and above. Third, oral and rectal temperatures are better. Fourth, age and symptoms are more important than the height of the temperature. And 5, treatment is not always necessary. Please make sure that you have considered if your child needs to be seen for further evaluation. And always, when in doubt, consult with a healthcare professional.